my name is Mackenzie VanderFeltz, and today I'm going to be showing you how to do trach suctioning and trach care. Let's go ahead and get started. So I have my patient here. I have already assessed him. Really all you're just looking for is to make sure that we do need a complete trach suctioning and trach care. Along with that, you'll also want to check irregular pulses, any labored breathing, and then like the appearance of the patient, coughing, anything like that. And then after you suction, you want to make sure that you look at the consistency, the amount, all of the gunk that you suctioned out, because you'll need to document all of that later. So you'll want to introduce yourself to the patient, and then you'll want to check their ID band for name and date of birth. Some patients with the trach can't communicate with you, so you'll have to figure that out with your patient, whether it be writing their name or just you saying the name and them nodding to make, or double checking with other documents to make sure it's actually your patient. And then you want to make sure that you explain to them what you're going to be doing. So a lot of the times when you suction trach, they it's just very invasive procedure. So a lot of the times they can't get good oxygen. So you want to give them a sign to use in case they need you to stop. Today we're going to be using a thumbs up. So if he needs me to stop, he'll give me that sign and we'll go from there. Another important thing to do is make sure that we hyperoxygenate our patient. So I have my oxygen on and it's the highest it can go. Because of the lab we're in, we don't have the control panel, so we're also going to be simulating our suction today, as well as our oxygen. So let's go ahead and get started. I'm going to wash my hands, and I'm going to put on some non-sterile gloves, and I'm just going to remove the gauze. Yes, and we are in his private room, and the door is closed. So I'm just going to remove this dressing, and this is dirty and can just be thrown away, and then as well as our gloves. And before we go any further, we are just going to raise him up into high Fowler's position. And this just makes it easier on the patient and easier on me to complete the procedures that we need to do today. Okay, we're going to wash our hands. And now we're going to get started with the suctioning portion. This is a sterile procedure, so once I get all my stuff on, I will have one unsterile hand and one sterile hand. I have my oxygen on him, as I said before, as high as it can go. Go ahead and open my sterile kit away from me. Get my sterile gloves out. Okay, and now this can go in the trash can. And this is a little basin for saline. We're just going to simulate that today. Normally, if you were doing this, you will pour saline in here, and that's what you use to flush your suction catheter out with. Okay, so here's my suction. Just going to kind of wrap this around my hand. And this is going to be my non-sterile hand. Find the end of my suction tubing and connect that. Make sure it's got a good tight seal. And now I'm going to move the oxygen away. We are going to insert this in. We want to make sure that we're not sucking anything while we're going in. Okay, and now when we suction out, we're going to intermittently suction and twist. Okay, and that should take 15 seconds or less by the time you go in and you come out. He didn't get a whole lot out, so we're done with suctioning at this point. If you need to suction more, that just depends on the amount of drainage you get out and the appearance of your patient. We're done with this. I'm going to go ahead and remove this and put it in the trash and put the oxygen back on my patient. Okay, and then we can dispose of all of this as well. I'm going to wash my hands. And we have this towel here. I'm just going to put it across his chest. And this is just used to make sure that we don't soil our patient while we are cleaning the inner cannula of his trach. Okay. And now I am going to open my Tracheostomy kit. And this is what we're going to use to clean. Before I get in there and I'm sterile, I'm just going to go ahead and open this. This is the gauze that we're going to put on after we clean. This doesn't necessarily have to be sterile. We just like to keep it clean. Okay, and again, we're going to open this away from us. And then I'm going to take out my sterile drape, and the 1-inch border around it is considered not sterile, and we're going to lay this plastic side down on the table, and this just kind of extends our sterile field. I'm going to get my sterile clothes out and put that on. Okay, then once you have those on, you can fix them. And again, we'll get rid of this. And now everything in our sterile kit we can take out and lay on this pad. And that way we get our kit cleaned out. And we are ready to pour everything in here. So the kit comes with 2 packages of hydrogen peroxide. You only need one, so I'm going to trash that. And these are our trach ties that come in the kit. We're going to use Velcro, so I can trash these as well. So I'm going to go ahead and pour my sterile water into the kit. For demonstration purposes, we can't use hydrogen peroxide on the mannequins, so I'm just going to use saline for both. But if this was on a real person, you would definitely use hydrogen peroxide. Go in the trash. Okay, so now that I have this all set up, if it was a real person, you would do sterile water in one side and sterile water and your hydrogen peroxide mixture in the other. Okay, so now I am going to so I'm going to, again, have one unsterile hand and one sterile hand. My dominant hand is going to remain sterile. My non-dominant hand I'm going to use to move the oxygen out of the way and to remove the inner cannula. It's hard to get these out. Okay, so this, we are going to stick, normally you would put this in the hydrogen peroxide and the water mixture to clean. And you're going to take your brush, you're going to dip that in, you're going to clean it on the inside and on the outside. Make sure that's nice and clean, and then you're going to put it in the sterile water side and kind of rinse it off. And you're going to take your gauze, dry it off really well. You can use your pipe cleaners to get on the inside. Okay, and now that that's clean, we can put that back in. Okay, and now that's back in, I am just going to go ahead and clean under the trach and around it, and it's good to use the cotton swabs for that. We're just going to use the sterile water side, and you just clean under here really good. Okay, and those can go in the trash, and then you're going to use gauze to make sure that you clean under it really well, and make sure it's really dry, because the moisture can cause bacteria, and that's not good. So we are done with that portion. I'm going to go ahead and remove these gloves and wash my hands, put on clean gloves, and put the gauze back around. While I'm doing that, I'm going to put the oxygen back on, make sure that he gets hyperoxygenated. We're going to move the oxygen back out of the way. We're going to put this under the trach. Okay. And now that that's all nice and clean, we have a new dressing under there. Now we're going to change the trach ties. I don't have another set. But how you would change this is you do it one side at a time. So you would undo the Velcro, and you would release it from one side at a time, like I said. And you just want to, most of the time these come pretty big, so you'll want to cut them to size for your patient, and then you just re-Velcro on both sides after you get it fit. And that is everything. You want to make sure you put your oxygen back on your patient and document everything you did. That's it. Thank you.